Hi everyone, my name is Joanne Mejia and I'm doing a current event on managed care which fits into this week's lesson. The title of the article is Suicide Risk Grew After Missouri Medicaid Kids Shifted to Managed Care, Hospitals Say by Phil Gelwitz. So this article talks about a little bit about I'm sorry, of the suicide risk that has increased by kids switching from traditional Medicaid to managed care plans. So, more than 2,000 Missouri children diagnosed with mental illness were switched from traditional Medicaid into three of the four profit managed care plans. With this occurred, when this occurred, state hospitals noticed a doubling in the percentage of children with thoughts of suicide or attempted suicide. For instance, a study conducted by the Missouri Hospital Association revealed an increase in the suicide ideation. The average length of stay in a psychiatric hospital decreased from 10 to 7 days following the Medicaid change in May 2012. The group did acknowledge that there could be other factors playing a role in the increase, such as social media, cyberbullying, and the lack of access to specialized mental health care. So the Hospital Association called on state Medicaid officials to investigate the findings. And even though the suicide rate in Missouri doubled from 2.8 to 6.4 in every 100,000 children, between 2003 and 2017, while suicidal thoughts are higher risk for suicide, there was no evidence that more children were taking their own lives after the move to managed care. The Missouri Plan Associated, which represents the three Medicaids in the state, said that the report was inaccurate, but they did say that they are taking the findings very seriously. Joan Acker, a director of the Georgetown University Center for Children and Families, called the report extremely troubling and said that the data doesn't confirm managed care is the cause of the problem, but it does raise questions whether children are getting the treatment needed. She went on to say that managed care is in an effort to try and reduce cutting unnecessary cost, but there are sometimes where other managed cares try to cut corners. So the article went on to discuss the study, looked at the impact of the state's shift of 160,000 low-income children living in 61 rural counties, managed care in 2017. The children getting coverage through traditional Medicaid, 10% had suicidal thoughts or made suicide attempts in 90 days after being discharged from an inadequate psychiatric hospital. And that did increase after the change to 19% when they moved to managed care. Towards the end of the article, it provides a link to a study conducted, and it's towards the end, and it has the hyperlink, and it's highlighted in blue. Right here. And it and the So the study was conducted by Medicaid and CHIP Payment and Access Commission, contracted with the State Health Access Data Assistance Center to explore physicians' acceptance of new Medicaid patients. So the data revealed that providers were less likely to accept new patients insured by Medicaid, 70%, than those with Medicare at 85% or private insurance patients 90%. It also revealed that psychiatrists accepted new patients at a much lower rate with Medicaid at 35% than Medicare and private insurance at 62%. So this brings several questions. Is this putting Medicaid enrollees at risk for reduced access to mental health care services? And is the amount of physicians that are taking new Medicaid patients, is that also putting them at risk into not getting the right care? So some might say that many private health plans have tightened the rules or the criteria for patients seeking inpatient care, which, if the patient is in a mental health facility as an inpatient, they might release them sooner just because they will not get paid by Medicaid. So I really like this because me working with in pediatrics, we also see, a decreased amount of physicians, especially in specialty areas for developmental and for psychiatrists, where the long waits list are very long. So patients have to wait, more than half a year or a year to get it into a visit. So thank you for listening, and I can't wait for your comments. Thank you.